Over the centuries, Scotland has seen people arrive on its shores, and always to the benefit of our country. We have one Scotland with many different cultures. Scotland has a wide community with cultures from all over the world, and that lends a vivacious tone to our life in Scotland. Chinese, Indian, Pakistani people bring their foods, religions and dress to our towns and cities, and, to our delight, share their foods, films and music. Diet, as we know, is the cornerstone treatment for diabetes, and that means that health professionals need to have or acquire a thorough knowledge of these people's customs, foodstuffs, food laws and manners of preparation and presentation.
To provide dietary education to linguistically and culturally diverse population, it is important to know their culture, their traditional foods, eating habits, and in general their way of life. As a dietitian, it is about giving consistent dietary messages based on national recommendations from a cultural perspective.
Sadly, among all those folk, there are some to whom diabetes seems a more regular risk. These people are mainly from a South Asian or Afro-Caribbean background.
I got a headache and I got a sore legs, and then I thirsty, lot of thirsty all the time. My mouth is dry all the time. And then I tell the doctor that this system, because my husband got sugar, maybe I got diabetic also.
I constantly feel very tired.
Actually, I was feeling too tired, and I was feeling something happening to my eyesight. I went to that eye infirmary. When I went there, the doctor found out, so you are suffering with diabetes.
I know I should be doing a lot of walks because I've got arthritis in my left knee. That's why that's putting me off, and I do exercises in the house. I've got the machines to do, so that's what I've been practicing.
I do yoga in the morning for 15 minutes, every morning.
Well, I'm age person, I can't do anything. I'm just walking, sitting, that's all.
What about physical activity?
We need to bear in mind the cultural norms. There are some people who have moved towards Western way of living, and there are those who prefer more traditional activities. It could be something like yoga, which is considered good for stress management. It involves muscle stretching. Then there's Bhangra, which is traditional dance from Punjab. It involves energetic movements and is a great cardiovascular workout. There's Tai Chi that promotes personal energy for self-healing and well-being. With tailored activities and facilities like these, people are more likely to keep up with healthier lifestyles.
I walk every day, and I cut down my fat intake and sugar. I'm very careful with my diet now, what I cook and what I eat. Don't think about too much, don't worry too much, and be positive and be happy.
Diabetes is about 4 times more common in South Asians living in Scotland. By South Asians, I mean people who themselves or whose parents come from India, Pakistan, Bangladesh or Sri Lanka. South Asians develop diabetes about 10 years earlier on average compared to the local Scottish population. Diabetes kills by causing heart disease, and South Asians have the highest rate of heart disease in the UK. Most of this is due to lack of exercise and a diet rich in fats like oils and ghee. The prevalence of diabetes is increasing back in South Asia as well. It is not solely a feature in immigrants. Traditionally, the image of being overweight has been associated with wealth and prosperity amongst South Asians, but the time has come to think differently. Losing weight and taking regular exercise should be a priority. If there is a strong family history of diabetes, and if you are overweight, you will have an increased risk of developing diabetes. Taking regular exercise and losing weight will reduce your chances of developing diabetes. Diabetes is not a mild disorder as commonly believed. Diabetes is a serious, chronic, progressive illness, and care should be taken from day one. Change in diet and lifestyle, most importantly, taking simple regular exercise for about half an hour has proven benefits. This could be a simple short walk through the park. Although diabetes may be controlled on tablets initially, you may need insulin later on. Insulin is now often advised in the early stages of the disease to prevent complications. It is safe and it is relatively easy to use.
Because when I was diagnosed in my working life at the university, I was a senior member of the department and just getting into some of the good things, like going to conferences where the reception was very good, drinks was flowing freely, and lovely food and all of the things that I really loved. And then suddenly having to, well, not give these things up, but to control my intake. When I was diagnosed, I was so perhaps shocked about it and determined to do what I was told, that within 6 months to a year, I had lost about 3 stone. But the point is, it was very good to discover that though I had diabetes, what the message was to control my intake, not to stop my intake. I have very few activities now because my health has not been all that good. Things are wearing out at the age of 82. You know, there's a lot that I can't do.
As I have said earlier, heart disease kills South Asians in the United Kingdom. If you are a smoker, you must seriously consider stopping. Consult your doctor or your pharmacist to find out what help is available. You should keep your diabetes appointments regularly for checkups. The doctor and the nurse will check for early complications of the disease, which are treatable. We realize that needs and cultures of South Asian patients are different to that of the local population, and most diabetes clinics will have resources in your own language. If you feel embarrassed because you cannot talk fluently in English, feel free to take a member of your family. You can also request an interpreter who could come along with you to the clinic.